have a complete clarification to the extent that you and the surgeon both understand clearly about what is to be done, what are the expected complications of the procedure. Hi friends, if you are going for male to female transition surgery, especially the bottom surgery, few things you need to remember and take care of before the surgery. Number 1, your GD certificate should be ready. Keep all documents in order. Number 2, HRT, hormone replacement therapy, should have been completed and well monitored by a good physician or an endocrinologist. Third, during your visit with the gender affirming surgeon such as me, you need to discuss in detail your desires, you need to have penetrative sex, you need to have proper understanding of the surgical procedure you are going to opt for, the post-operative follow-up, the need for lubrication and the need for post-operative regular dilatation. You should ask these questions specifically from your surgeon and have a complete clarification to the extent that you and the surgeon both understand clearly about what is to be done and what are the expected complications of the procedure and how is the post-operative recovery going to be. After that, before the surgery, you need to have your pre-anesthetic fitness done. An anesthetist must see you and check your body to see whether your body is fit for surgery. Additionally, you must make sure that you have complete and permanent removal of your pubic hair and the hair surrounding the base of the penis and the scrotum, because if you are going for penile inversion vaginoplasty or peritoneal pull-through vaginoplasty or sigmoid vaginoplasty, all these will involve creation of the external part of vagina, which is going to involve the penile skin. And if you have hair over there, these hair might grow inside the vagina, and growth of these hair inside the vagina will create n number of numerous problems, ranging from pain, ranging from infection, ranging from foul smelling discharge, even formation of hairballs and stones in the future. And this could make dilatation really painful and you could actually land up with losing the newly created vagina. So these are all the preparations that you need to have in order, with a clear understanding, proper documentation, proper preoperative assessment and a thorough discussion with your gender affirming surgeon, sex change surgeon before you proceed with any procedure. Thank you.